Thank you very much to you, the organizer, for this invitation. It's really my big privilege and honor to start the scientific part of this conference. It's an honor also to have some American doctors here. I learned so much from them at the Autism Research Institute conferences in the past. And I'm really glad to be able to share with them and with you what is my experience in the last 15 years. Because I'm the first of all, I want to say that this is just scientific informational purpose, okay? Don't use all the medication I will introduce as medical advice. But you can discuss with your doctor what can be also useful for your patient or your children, I mean. So your first lady here already introduced what is autism. I mean, what you can learn just reading the first page of NIH or World Health Organization. But let me say, that's just the surface of the problem. We will try in these days to go deeper in what is causing autism and what is happening in the body of these children, the brain and all the body of the children. So we will be more familiar with the concept of inflammation, intoxication, chronic infections, and oxidative stress. They already mentioned that the increase of autism all over the world is dramatic. We have out of 44 kids now recognized in USA affected by autism. But this level, is about children that were born in 2010. And because we have a constantly increase every year by 13%, it's very likely that today children that are born in 2020 could be even 1 out of 20 or 1 out of 30. So that's something that is really important to know. We cannot say it's just genetic disorder. You know that's what I usually listen from many colleagues, because genetic disorder, for definition, they never change the rate over the time. They are always the same rate. So if we are still observing year by year an increase of rate, means that there is something in the environment that is happening in these kids. That's why I call that epidemic. For sure, we are living in a toxic world, and the accumulation of toxins, heavy metals, chemicals, pesticides have a very important part in this game. For example, we are, as Italian, we eat a lot of fish, okay? So it is really traditional for us. I always found mothers eating once, twice a week fish in their diet during breastfeeding and pregnancy, having a lot of mercury in their children. So that's something that we should take into account. And still gynecologists are suggesting fish during pregnancy because of omega-3, you know. Why is that to be very dangerous now to consumption of fish, not just for in childhood and mothers, but for everyone. And then I've been trying to study a little bit about air pollution in Serbia. It seems in Europe that Serbia has the worst level of air pollution, which is affecting severely the level of health condition and with loss of years per year has been really dramatic. You can see in this picture in red just Serbia, Kosovo, and Albania. It seems to be a kind of a iron curtain between the west of Europe and the east of Europe for the level of particulate matter, which are this really little dust that can go inside our body through the lungs and can affect the level of inflammation, intoxication. And usually they don't never go alone, but they have always bad company with chemicals and heavy metals. I've been studying in 20 of my patients the level of intoxication, and I found out that 2 out of 3 kids have a porphyrin test positive for intoxication. Okay, that's a metabolic test, which is trying to show the level of how the metals are affecting their body. So I can say in my practice that 2 out of 3 kids very likely have a high level of heavy metals. But not just heavy metals, agrochemicals are very important part also. You can see that country where there is a very strong impact of pesticide in agriculture, having a very high rate of autism. So you can see how Japan and Korea are almost double the level of in the UK or in USA and the other country. Glyphosate seems to be one of the worst one, affecting the microbiome, the gut inflammation, the brain inflammation, mitochondria functions. Electromagnetic pollution is something that is growing year by year, and some researchers are pointing that could be also important in these kids. Then we have some medical practice that can be involved. In the last 30 years, the number of kids that are delivered by C-section are growing a lot. In Italy, there are 30% of kids they are using cesarean section, which is for sure very useful for most of these kids, but help us to understand why it can be correlated with autism. And after me, my colleagues will talk a lot about microbiome, this internal world of microorganisms that we have in the gut. Think that adult people can have 2 kilograms of bacteria, which are producing neurotransmitters, modulating the immune system. And when the children are naturally delivered, they passing through the vaginal channel, they drink the vaginal liquid of the mothers, which are rich in good bacteria, and they promote a normal growth of this microbiological world in the gastrointestinal tract, in the colon of these children. While the bacteria that for the first time go in the gastrointestinal tract of children with autism, no, sorry, not autism, the children with C-section, are coming from the skin of the surgeon and the mothers, and they usually are bad bacteria. They are taking place instead of good bacteria. The same is happening with formula milk, because children with not breastfeeding, they are not having this important modulation of the microbiome coming from maternal milk. And using antibiotics have the same impact of the microbiome. So studies say that C-section can increase 5-fold the risk of allergies, 3 times the risk of attention deficit and hyperactivity disorder, twice the risk of autism, and increasing 70% even risk of diabetes type 1. So we can see how just this medical practice can affect our children in developing allergies, neurological disorders, and autoimmunity. Then paracetamol also this is a little bit controversial, but they are showing that paracetamol can also affect and increase autism, because this medication is producing a depletion of glutathione in our body. So it's creating a strong oxidative stress, which is making abnormalities in the immune system and also in the brain development. Then another important factor, which is having even more attention recently, it's the increasing of Lyme disease and co-infection. In last 15 years in USA, the level of cases of Lyme is increased 25-fold. And 25% of them are children. So many of our kids who are having diagnosis of autism or PANS, panda kids, you will listen other colleagues talking about this neuro-autoimmune disorder. It's called PANS, pandas. It's very likely they are having also Lyme disease. And the situation is not different in Europe. So what is autism? This is my personal definition of autism. It's an encephalopathy, means that the brain is suffering. It's multifactorial because we have many environmental factors involved, and it's multisystemic because many organs can be affected. First of all, the gastrointestinal tract, then we have immunological allergies, autoimmunity, then we have some hormonal problem that can be affected. So many parts of the body of these children are affecting. And then we have also the neurological and brain problems. So that's the best picture I have to show what is what I think is my work with children with autism, okay? It's not because I looks like Hercules, okay? But it's more because it's autism is like the Hydra, the mythological monster that has many heads. Every time you try to cut just one head, other two heads will come out, okay? And the situation starts to get even worse. So what we can try to do, what I try to do, even in the Titanic fight, is try to cut all the head in the same time, which means to try to treat all the clinical manifestation the children in the same time to try to fight to help in recovery these children. I try to identify different phenotypes of autism because I don't know if you agree with me, but we have not just one autism. We have so different kids and they have so different clinical manifestation. So this picture make me work easier to try to understand which of these phenotypes are in that child and how to treat them. We already mentioned intoxication. We have allergies. They are more common in autism than the most of normal population. We have a mitochondrial problem, which are little organs which produce energy. The richest, mitochondria is the 10% of our body, and they are producing mainly energy in the brain and the muscles. So when we have a mitochondrial problem, these children have a motor skills problem, hypotonia, but also mental delay. Then we have autoimmune disorder, autoimmune activation. We have a chronic infection, like yeast, parasite infection. Mainly they are also affecting the gut. And we have also viral infection, which I put apart from them. So we can have a child that is having overlapping of some of these clinical manifestation. For example, toxic intoxication can lead to mitochondrial problem because we have a strong oxidative stress, free radicals, which are burning the membranes of mitochondria and make them work less, or can even trigger autoimmune disorders. And we'll try to explain also how it can be, how it can happen in the brain. And these last three that I highlight in red are also more likely to find in children with pandas. I think there is a overlapping of autism and pandas. So in many of these manifestations, I've seen children with autism after a few years became clear pandas, and I see children with pandas diagnosis having autistic symptoms. So usually I don't care when I treat a child which kind of label he has, but I try to understand what are the underlying medical problems that we can try to fix, possibly altogether. So we did this research in 2019 with Professor Abu Donia of Duke University of North Carolina. He was working on autoimmune antibodies against the brain. That's why I was interested to collaborate with him. And I asked him to check the level of neuronal antibodies in children with autism. But he asked me, listen, why you don't send me also the blood of their mother? And why we don't involve also normal kids and their mother? So we check these four groups, okay? Children with autism and their mother, normal children and their mother. And what was really striking for me to see is that normal children, mothers, normal children, and normal children, they don't have autoimmune antibodies. You see, there are different autoimmune antibodies. And but both the mothers and the children, for all the protein that we checked, had autoimmune antibodies. So it's not just, I was expecting just in the children, but we have autoimmune antibodies, even the mothers. How to explain that? Then I studied better the research of Professor Abudonia. He did this research first on neuron antibodies in a patient with neurological symptoms and chemical exposure. Which chemical exposure they have? They are farmers that were using pesticide, and they were having the same antibodies that we found in children with autism. What does it mean? What can be the explanation of this? That there is some exposure to toxins, pesticides, heavy metals, and others, even infection, that is opening the blood-brain barrier and is exposing the neuronal protein to the immune system, which is producing these autoimmune antibodies. It could happen during pregnancy, for example, or maybe after birth, both mother and children having the same exposure, having the production, the same kind of reaction. Anyway, what was interesting that all of them, mothers and children, have these neuronal antibodies. So I don't mean that children with autism, they all have autoimmune brain disorder. But that's what is interesting for me, that this is explaining that we have a toxic exposure which is creating brain inflammation. In some children can be also autoimmune disorder, like in pandas can be a clear autoimmune disorder. In other kids, we can have a different form of autoimmunity, which is called also microglia activation, and I will try to explain you later. So we are halfway, okay? Resist, we have other 20 minutes, almost. Now the best is still coming, okay? Now I try to talk about therapy. So we try to explain what is causing autism and what can be happening in the children with autism. Now let's see what we can do. I've learned by Autism Research Institute that this 3R strategy, okay, which is remove what is toxic, replenish with something good, and repair, try to let the immune system and the body, the metabolism to work better. First thing, for sure, it's organic food, organic diet, gluten-free, casein-free diet. That's, in my experience, is working, but even all the report of parents you can find also on Autism Research Institute say that 80% of children are responding to this diet. And not after 1 year, but even in 2-3 weeks. It's like a veil that is falling from the eyes of these children. They can start to see you in the eyes. They start to responding to you if they were not doing before. So that's something, let's say, very natural that I invited the doctor here to try if they are patient with autism. That can be so effective and so dramatically life-changing for some kids. Of course, I'm Italian, so it's very difficult, this diet in Italy, but we try to do our best. Also, another way to remove toxin is treating constipation in these children. My image for this is, the gastrointestinal tract is like a river. If it's flowing, the toxin go away and the water stay clean. But if we have constipation, then we start to have a process of fermentation and accumulation of even fragment of bacterial product that can activate more the inflammation. And we can show many studies about dysbiosis. This is just an Italian study, that's why I like to show you, where it's showing that almost 60% of children with autism have a yeast problem, have a Candida species. So Sid Becker, already many years ago, make this antifungal parade a way to treat deeply the yeast, which are really producing neurotoxins that are affecting the brain development. This is let's say, more pharmacological way, but you can find also some more natural way if you prefer. There are other interesting research about Clostridia, how Clostridia produce neurotoxin, which are directly activate the brain inflammation. So removing Clostridia for some kids are very important. Of course, you have to make some tests. You have to ask your doctor doctor will suggest you tests to check if they have this kind of microorganism. And according to them, it's very important to treat them. Some kids have overgrowth of bacteria in the upper part of the gastrointestinal tract, and maybe they need to remove this bacteria. My favorite antibacteria is rifaximin and nifuratel. And even parasites. Some kids are struggling with parasites. It's a very easy way, in my experience, to recognize parasite. I teach this to the parents. If your child is putting object in his mouth very, very often, is putting finger in his mouth, is grinding teeth, is in waking up in the middle of the night screaming, especially if in the full moon time, I don't know why, but it's happening, okay? So for me, those are clear signs of parasites. And when parent then I give treatment and they do that, all these symptoms like magically disappear for the most of them, okay? Another way I teach the parent to understand a yeast problem. Children with yeast, they usually start to laugh, no reason, very often, especially after eating starches, sugar and French fries, and even pasta and biscuits. So that's a sign of a fermentation of yeast in the gut, producing maybe ethanol. They became like drunk, okay? That's for me another sign of clear sign that he has dysbiosis. Then, of course, removing also chronic infection like Lyme disease and viral infection. But I believe other doctor will explain you how to do this. Another important way after removing the treating and reducing the toxic and inflammatory accumulation of toxin in the gastrointestinal tract is working on heavy metals. That's after diet, I found out is one of the most effective treatment for these children. It's called chelation from the Latin name of chela. Chela is the branches of the crab. So when they found heavy metals, they catch them, this medication, and they help the body to remove with urine or with stool. The MPS is very specific for mercury, the DTA for lead, while the MSA is more working on both direction. That's one of the part porphyrin. This is another test I usually recommend. Is red blood cell elements. Red blood cells are like little organs which accumulate heavy metals. This child is a child of a mother which she was eating fish twice a week during pregnancy. In fact, you can see we have a lot of mercury and also depletion of iron, zinc, and selenium, if you will notice. So, but the most sensitive test, in my experience, is called provocative test or challenge test. These are the urine of the same child without any provocation, without giving any medication. And as you can see, nothing is really coming out. Everything is in the green area. But after subministration of the MPS, that was the level of intoxication I found. So that's for me a very clear sign of intoxicated kids that have to be cleaned. And this is some of my Serbian patients. I have never found mercury in Serbia. Why I find a lot of lead. You see 170 micrograms is for me is a lot. I don't know your experience, but this is for me is a lot. We have a 32, we have 40. Okay, so for me, working on lead intoxication, that's something that I've seen not just in Serbia, but almost all the Balkan area, but even in Ukraine and Russia, with Romanian patient, Bulgarian patient as well. Okay, so that's very common. I think this is depending from air pollution and particulate matters and this big problem that there is, I think, in this country to still using energy from fossil fuel, from burning fossil fuel. So replenish means to make in balance the oxidative stress, giving good antioxidant and reducing free radicals. And this very famous research of Jill James is explaining how just giving to these children few supplements like vitamin B12, betaine, and vitamin B6 is already helping these children to get better and to neutralize the markers of oxidative stress in their body. The other way to support the detoxification is supporting the oxidative stress with sulfur-containing antioxidant, like N-acetylcysteine, taurine, and glutathione. Glutathione, we know, is our best antioxidant. We produce glutathione in our body, and that's the best way that we know to clean our body. So, but we have removed everything. We have removed heavy metal. We try to control the dysbiosis. We have removed, maybe with antibiotics, chronic infection. But what we can still do if this child is still not recovered or is not improved? What I think is happening is that even if we remove what was causing the problem, there is in the brain a self-maintaining process, which is called microglia activation. It's like if I'm smoking 20 cigarettes per day for 20 years, and I have lung cancer after 20 years, I will not feel better if I remove the smoking, if I quit smoking. I need to do something for the lung cancer. That's what is happening also in these kids. Once we remove toxin, we have also to calm down the brain inflammation, which is called microglia activation. I will try to explain very, very easy, very fast, what is this neuroinflammation, microglia activation. Researchers found out that there are these microglia, these inflammatory cells in the brain of children, overactive, especially overproducing 3 inflammatory messengers, which are called also cytokines, which are interferon gamma, TNF alpha, and interleukin 1. So what is, when the microglia is in a resting condition, it's supporting the brain to develop better. While when it's activated, it's producing inflammatory messaging that making the brain to stay in a like alert state, inflammatory state, like to fighting some infection of toxins. And usually all the toxin or the factor we already mentioned can be directly triggers of microglia to produce exactly the messengers that we have found out in that study in the brain of children, but also producing high level of glutamate. This TNF alpha, interleukin 1, interferon gamma are also inhibiting this transport of glutamate. So a lot of glutamate stay in this area, overactivating the NMDA receptor on the neurons. When these receptors are overactivating, because we have a lot of glutamate here, a lot of calcium is going inside the neurons, and we have a process of overexcitation. The neurons start to be overloaded by calcium and overworking, and they start to degenerate and die. The microglia activation is not just something that belongs to autism. It's something that we find in all the chronic neurodegenerative disorders. And that's why medication that you can find in Alzheimer or in multiple sclerosis, on cerebral ischemia, could be even useful for autistic kids. But there is another partner in this crime, and this is the mast cell. Doctor knows mast cell as the cell of allergies. They are the cells that are in all the surfaces of our body, all along the gastrointestinal tract, on the skin, on the lungs, and they are overactivated from all the factors we were mentioning before. Dr. Theoharidis, which is one of the most well-known researchers of mast cell and neurological problem, is showing very well in this picture as mast cell, when they are facing Clostridia toxins, gluten, casein, and yeast problem and fragment of bacteria, they overproduce dozens of inflammatory messenger. And then these inflammatory messenger are also awakening the mast cells in the brain. So the mast cell is almost between the environment and the microglia. They can directly activate microglia, but also mast cells are a very important part in this game. So all this explanation to say that maybe we can work directly on the brain, working on these three different steps. One is mast cell activation. The other one is working on directly on this receptor. The other one is balancing the overload of glutamate. So I have here many options. I give you many options. There are even more. Just to try to explain how we can work directly on the brain. One of my favorite is PEA, or palmitoyl ethanolamide. This molecule, is natural molecule, is working on cannabinoid receptor. We published a few years ago that the cannabinoid receptor in the immunological cells are activated, overexpressed in children with autism compared to normal children. What does it mean? It means that the body tries to compensate this self-maintaining process of inflammation over expressing this receptor, which when activated, we reduce inflammation in the body. So when we give a PEA, we are just working on those receptors that we found on microglia, we found on mast cell. So PEA is mainly a mast cell stabilizer, okay? And we published this paper about case report of PEA in autistic kids. They were teenagers, improving their healthy condition, the social skills, and the speech also. So I found out that this molecule is very useful, especially in allergic kids with hyperactivity and behavior problem coming especially in the season. You know, when I have a patient told me, my child getting worse during the spring and the autumn, while suddenly is getting better during the summer. And that's a sign that there is very often allergic mast cell activation. The molecule I was using in this Italian product, I'm so proud of this product. I have no interest, economical interest with them. Just I like this because what makes the difference with other PEA is that it's been ultra micronized. So has been compressed with nanotechnology less than 10 micron. So this molecule can be absorbed in the gastrointestinal tract and can even pass the blood-brain barrier. But then Dr. Theoharidis, we mentioned before, was also studying luteolin as important to reduce the level of inflammatory messengers in the body of children with autism. I found out that the same company producing ultra-micronized PEA was producing even co-ultra-micronized PEA with luteolin, which I found out will be very effective in children with autism. So that's why, for me, one of my first choices when I try to help children with this microglia activation. And like you can see, in my experience, 2 out of 3 kids can improve using this PEA-LUT, which is combination of PEA and luteolin together. Then working on the cholinergic pathway, it seems to me very, very important to reduce calm down microglia activation. Galantamine can be an option, but even phosphatidylcholine or CDP choline, they are simple supplements, can be working in the same direction. And recently, I found a game-changing product, the nicotine patch, or even oral nicotine. I found out very interesting because working on nicotinian receptor in the brain, but also working balancing the autonomic dysfunction, these children. What does it mean? It means that children with autism have an overactivation of sympathetic system, which means fight and flight state. So, you know, when you have a child, it's always irritable. When you say something that they are not accepting, they start to be impulsive and aggressive. They are very anxious. This is a chronic activation of sympathetic pathway. While parasympathetic pathway is helping to relax, to sleep better, to digest. So stimulating this parasympathetic pathway means to calm down children. And I'm not using it to everyone, but when I'm at the point that one child with autism have a really big problem with aggressivity and rage, and they start to think to give antipsychotic medication, this nicotine has saved a lot of patients. So that's my experience, is something that is really life-changing for some kids. So memantina is one of the medication that can work on this receptor, and mainly it's a medicine for Alzheimer, but is working very well in autistic kids, especially in learning, attention, and language. And then something we can do in this third level, it's a simple amino acid like GABA. I like so much GABA. When you have some hyperactive kids, just giving GABA, in 2 days you see another child, just calming down. So because these are, GABA is simple amino acid, but also is an inhibitory neurotransmitter. So you just give a little bit more of this amino acid in their body, and it seems calmer a little bit. Okay, so conclusion of my speech is that the pathway of healing of the neuroinflammation in the brain of autistic kids require a complex strategy of intervention aimed from one side to remove those environmental factors that chronically stimulate inflammation in all the body, and from the other side, break the vicious cycle of mast cell glial network activation. Thank you for attention.
We have time for about 2 questions. Does anybody have any questions?
I need...
Yes?
I'm wondering about MMS. What do you think about this? Is it suitable to give this supplement to kids with autism with caprylic acid, or?
Sorry, which one?
A supplement, sulfur.
Sulfur supplement.
Yes.
Okay, sulfur supplement like N-acetylcysteine and glutathione has been the most studied supplements in autism, but I usually use very carefully because the sulfur of glutathione of NAC are like feeding the yeast. So especially beginning, if we have a big gastrointestinal dysbiosis, especially with yeast, I will not start with them, okay? I rather prefer IV glutathione or IV N-acetylcysteine, which is bypassing the gut in order to not feed the dysbiosis.
Yeah.
Hello, you're hearing me? Okay. When start treating the yeasts, for example, candida or other things, what you suggest regarding the Herxheimer reaction that can appear, including toxins and anything else, because the situation in some cases can be much worse than on the beginning.
Yeah, you are mentioning something that is called die-off, okay? A die-off reaction, because when you kill the yeast, they can explode, release toxins that make them get worse, usually for 3-4 days. That's what I usually see. And first of all, it's important they are not constipated, in my experience. Second, it's important that you can give also some absorbent, like activated charcoal or enteros gel or silica. They are very natural substance that catch the toxin, so you reduce this level. But sometimes, if this you start to give antifungals, and your child, instead of getting better, is getting worse, especially showing anxiety and aggressivity, impulsivity, that could be because you are promoting bacteria in the gut. So you know what is up in the gut? It's like the mafia. I'm very expert of mafia in Italy. Okay, so when you kill a company, the other is taking advantage. Okay, so it's important to understand if you are having a day off or you are just promoting something else that is growing. That's why year by year, I'm changing my way of working. I prefer to give always antibacterial with the yeast treatment, to take also into account that some bacteria can take advantage.
Dr. Antonucci, we have a question from online. Did you have a case where a child with autism wouldn't eat, but the child does not have any gastrointestinal problems?
Yes, as the studies say, about 70–80% of children have the gastrointestinal problems. But we have 20% of kids, they have no problem with the gastrointestinal tract. As I showed before, we have different clinical manifestations, and not all of them have to be there. So it's likely to find children with no gastrointestinal problem. Those are my favorite because they are the easiest in my experience. I don't know if you agree. Thank you. Thank you for listening.